An investment in emergency medical services that began during COVID is reaching fruition this week. For the first time, the South Dakota Department of Health invested state dollars into EMS grants. The program began with $20 million for new equipment and then a study assessing the current state of EMS in South Dakota. The latest $7.5 million grant opportunity is tonight's Your Money Matters.
EMS across the country is in a very fragile state, including right here in South Dakota. Volunteerism is dwindling.
For decades, ambulance services across rural America have operated on volunteers. But EMS services across the country are struggling to stay open as the cost of services increases and volunteers retire with no new ones taking their place.
We're anticipating that there's going to be a change in how EMS operates. So it's kind of an onion. There's a lot of different layers to it when it comes to workforce, when it comes to reimbursement, when it comes to folks being on call 24 hours a day, 7 days a week.
It's why the Department of Health is looking to fund some creative solutions between ambulance services, healthcare organizations, and private EMS companies who could work together to make emergency services across the state more sustainable.
That they rally together and submit a grant so that they can work in conjunction. And we think that's going to be much more powerful.
It's wonderful to see that the state has put out money to look at sustainability of ambulance services and regionalization, because the grants kind of focus on how can we work together to better utilize ambulances in our areas and work together to reduce costs and improve patient outcomes.
Del Rapids is one ambulance service that's had to switch to a paid program due to a lack of volunteers. They are now working to submit a grant application with other regional partners to help continue offering this essential service in their community.
You don't usually think about an ambulance until you need it. And when you need it, you want it right away. And so you're right, it's not an option for us not to provide this service in our communities. We need, in order for our communities to thrive and grow.
Friday is the deadline for organizations to submit applications for the $7.5 million in emergency medical service grants from the Department of Health. We have a link to the application with this story on KELOLAND.com.